Başlıyoruz değil mi? Hi everyone, welcome today. We might wait a couple of minutes for the newcomers. Yeah, I think I will start, and yeah, we can continue with the new participants. Welcome again. Today, we are at the last day of our European Public Health Week seminar series. Within the European Public Health Week, as the HADI group, Public Health Thought and Innovation group, we organized 5 seminars until today. And today's topic is synergy for health, bridging the public and private sector, will be presented by Dr. Ömer Ataç. Ömer Ataç, I would like to just introduce Ömer Ataç, and I will let him to be with you and the rest of the afternoon. Ömer is an assistant professor in the Department of Public Health in the Istanbul Medical University, and currently a visiting postdoctorate scholar in the Department of Health Management and Policy, the University of Kentucky, United States. His research focuses on primary care services, evidence-based public health, diabetes epidemiology, and pharmacoepidemiology. Dr. Ataç earned his Doctor of Medicine from the Marmara University years ago, and Doctor of Philosophy, his PhD in Public Health from the Istanbul University. We also had some lessons together. Today he will talk about the collaboration between public and private sector, synergy for health. I'm giving you the microphone now, Ömer.
Thank you, and hello everyone. It's a great honor to be a part of that weekly webinar series during the European Public Health Week, and organized by our society with the collaboration with the Istanbul Medical University. And in this session, I'm gonna talk about the bridging the public and private sector to be healthier tomorrow. And before starting my presentation, I would like to remind that I'm not going to talk about the public-private partnership as a financial contract model, because I'm not a health economist. I'm not a kind of expert on this area, and our main focus will be just on the improve collaborations between public and private sectors. Public-private partnership is a very unique, special topic, so it's out of our framework for today. Let's start with the definition of the synergy. Why I choose as a headline that term synergy. I'm sure all of you previously heard about the synergy and also potentialization, especially during our years in the faculty, School of Medicine, or other undergrad degrees. We heard that kind of terminology as synergy and potentialization in the chemical reactions. When we look at the definition of the synergy, we can find lots of different terminology, but I choose only the first 2 ones. The first one is the interaction or cooperation of 2 or more organizations, substances, or agents to produce a combined effect greater than the sum of their separate effects. That's why I choose that figure as our aim must be to reach the 1 + 1 more than equal to. That must be our main goal if we use the synergy as a term. The other definition is the combined power of a group of things. when they are working together, that is greater than the total power achieved by each working separately. So our essential aim must be to produce greater power, greater outcome, or greater benefits than their mathematically total power. And we should also look at the definitions of the sectors, I mean, public and private sectors, which is our main partners, shareholders in this our session. There are also many different definitions for both of them, I mean, public and private sectors. Let's first look at the public sector. As a brief definition, we can define as the organizations owned and operated by the governments. Or, according to another definition, more related with the economy, a part of the economy which is controlled or owned by government. And if we want to detail about the definition of the public sector, this sector includes the public goods and governmental services like infrastructure, public transportation, military services, law enforcement, our education system, public education system, and of course, healthcare, and all of them, those working for the government itself, such as elected officials or staffs. What is the private sector? How it is it defined? The part of the national economy which is not under the directly governmental control, or we can also define as the constitutes the segment of the economy owned, managed, and controlled by the individuals or organizations which are seeking to generate profits. But when we just define two main groups as public and private sector, non-governmental organizations, NGOs, and private non-profit foundations are also listed under the private sector term. So during the whole presentation, or when we are thinking about the private sector, we should separate business industry, non-governmental organizations, and private non-profit foundations. But today, I'm just trying to share a brief some bullet points about the whole private sectors without, I mean, it's not correct to say without, but I just make some minor differentiation between those three main groups, but I try to mostly focus on the private sector as a general group. To be able to create a collaboration between the public and private sectors, especially in the healthcare, first we should understand their pros and cons, in other words, advantages and disadvantages, or we can define this as a like kind of strength, weakness, threats, and also what are the advantages, pros of the public sector? You know, in general, public sector primarily focus on the overall public health management, especially the public health management, and public sector ensuring the services which are accessible and equitable to all population, all citizens, without any disparity or discrimination. So it involves the managing public health crisis, providing essential health services, and also regulating standards. But the main cons of the public sector is most of the governments frequently face challenges, kind of limited resources. I mean the human resources, or we can also say the financial limitations in the financial resources. Another major disadvantage of the public sector is the bureaucracy and ineffective use of the resources by the governments. And lastly, the overusing of the services, overcrowding in the health institutions, visits, appointments, and other procedures performed by the governmental healthcare institutions. Overusing and overcrowding is one of the biggest challenges all around the world. And for private sector, let's start again with the pros. Innovation and technology, efficiency and quality, specialized services, and customer service are the main pros of the private sector. I mean, private sector often leads in adapting or developing new medical technology treatments, driving innovation in healthcare, mostly performed by the private industry, business industry, private sector. And mostly private healthcare providers are typically motivated by the competition to improve service quality and efficiency to attract and retain their patients, their catchment area. But I'm going to also talk about some potential threats for the competition and that kind of tries to retain patients. But if we can limit in the acceptable borders, it would be provide many advantages for our healthcare system. Another advantage is, the private sector mostly offers specialized medical services that might not be economically affordable or viable in the public sector, but it also includes some threats. And as I listed in the presentation, the customer services by the private sector mostly better than the public sector customer services. I mean, it includes shorter wait times, more comfortable facilities, more qualified services besides the direct healthcare services like appointments, environments, the quality of the facilities, and so on. But there are also many advantages or cons of the private sector. The one of them is the cost, because most of the times private healthcare can be expensive and it may create some burden of the patients or the population, and that's why limiting access for those without sufficient insurance or financial resources is a challenge in the private sector. And one of the major threat is the most private sector, as it usual, mostly based on the profit motive. I mean, the main motivation is to build more profits according to their main goals or main ideas. So the focus on profitability can, sometimes lead to ethical dilemmas, ethical concerns, such as prioritizing the more profitable treatments regardless of the medical necessity. This is one of the important and hot debates, discussions about generating a balance between the profit versus, profit for these entities itself, these institutions, or profits for our overall population. Another disadvantage of the private sector is also related with the previous ones in unequal access. The high cost of private healthcare can, exacerbate the health disparities by limiting access to high quality care for especially lower income individuals, the people who are listed in the lower level or bottom of our socio-economical status. So it generates another problem for our healthcare. And finally, the fragmentation of the care is another cons of the private sector, especially the care can be fragmented with the multiple providers. For example, I'm in the United States, and it's not easy to understand the whole general structure and details of the healthcare system because it's so fragmented. And this fragmentation can be lead to inconsistency in patient care, medical records, to create and to build accessible services as a national healthcare services. But in general, everything in our life has some advantages and disadvantages. The main idea is to build, to generate collaborative systems with with improving our better sides, our strengths and advantages. Let's make a brief definition for the collaboration. It's a really wide range term to use in our all life, in our daily life, professional life, private life, etc. But it can be ranged from the highly informal or non-binding to formal partnerships. And there's a special term to include to engage the private sector, as which is defined by the World Health Organization, private sector engagement. It means that a partnership between the public and private sectors to achieve a specified goal, such as just a simple agreement between public and private sectors to exchange some information on a particular topic or issue, or it can be a kind of formal partnership which involves the creation of new organizational entities, joint investments, or legal agreements for that kind of long-term commitments. The spectrum is really wide. And all types of that kind of collaborations along that spectrum have the potential to be beneficial, but the main thing is none of them are easy to build, initiate, and maintain. Evidence shows that the substantial proportion of the collaborative alliances or partnerships from many sectors do not succeed their intended goals. We don't have too many great real-world experience to create collaborations between public and private sectors. And this engagement can be include private actors in development of that kind of, as I told you, the public health policies or some kind of contract arrangements. Also, public sector can influence private sector behavior through some regulatory or financing policy tools, and assigning private attributes to public sector organizations. Some of the countries, as you know, try to decentralize some of the healthcare services, especially the administrative or managerial positions, especially in the rural areas. But it's not easy to succeed and maintain that kind of attributes. And if you want to renovate or renew your bureaucratic system, you may try some part of private attributes to public sector organizations, for example, by giving them managerial autonomy and exposing them to some kind of market forces and incentives. I just try to be careful to use the market term because of as a healthcare professional, as a public health workers, public health professionals, for me, and I know the most of the public health colleagues, against the totally commercialization of the healthcare. That's why I just try to be careful, use the market term in my presentation. So why do we need the engagement, the collaboration between the public and private sectors? Let's go back almost 40 years ago. and I just remind the first international conference on health promotion at Ottawa. I'm sure all of you already heard about the Ottawa Health Promotion Conference, and it is the first international conference which is defined the health promotion. And health promotion is the process of enabling people to increase control over and to improve their health. And also in this conference, the prerequirements for health were also defined. What are those? Fundamental conditions and resources for health are the peace, shelter, education, food, income, a stable environment and ecosystem, the sustainable resources, social justice, and equity. I mean, I think we don't need to lots of details about the multi-sectoral partnership requirement in the health to make to build a healthier tomorrow. If we just think about and focus on that kind of pre-requirements for the health, it's not hard to understand. I mean, it's so easy to understand the need of that kind of collaborations, and especially the bridging the public and private sector, because it's as we can easily understand from those listed items, to improve population health typically involves the collaboration among the government, non-profit, business sectors, and not only in the health sectors, but also with the other sectors, because it goes beyond the health lifestyles to well-being. It's directly and closely related with the education, economic development, housing, transportation, what else? Agriculture, of course, healthcare, but also the public safety and some other organizations directly related with directly or indirectly affects our well-being and ultimate health level. And so it's not possible to any single organization or sector by themselves cannot full control over these determinants of health. I mean the social determinants of health. Effective and valuable solutions require the inter-sectors and inter-organizational coordination and collaboration. I'm also sure about that all of you already knew about the social determinants of health, and it's really widening and improving our vision to take care of the health and health-related issues in our daily life, as a person, as an individual, or as a member of the community, or as a more wider perspective, the country level or global level. So it really requires a whole of society approach. I mean, the populations and the systems, the states, governments, public or private sectors, are really too large and too complex for either public or private sector to address all of that kind of problems and issues alone. So it looks essential that the public and private sectors address them together. Determinants of health always requires multi-sectoral partnership, and the community organizing refers to the unit of analysis and action, shifting the focus from the individuals to the systems, rules, social norms, or laws to affect the health behaviors and outcomes. So we can call this approach as a kind of ecologic approach. It means perform our implementations not only at the individual level but also in the system level. So this approach recognizes the connection between the health and social institutions, surroundings, social relationship, our daily environment, work environment, etc. And these efforts to improve the population-wide outcomes, we need to success them. Let's just a brief list to benefits of the synergy. I'm not going to talk about in detail about the whole theoretical frameworks or concepts in a just kind of informative brief session, but we can classify in the 4 main groups. As the first one is the prevention of monopolization. It means, it's a bit related with the political science or governmental administration areas, but these areas also some relationship with the management style of our healthcare services. So, the monopolization has been discussing for many years to create a balance between the public sector and private sector, and in our all around the world, we have more than 200 countries, and each of them has some unique characteristics. I mean, in terms of that kind of balance between the public and private sector. Some countries are highly under domination of the private sector, and some countries, some governments, almost 100% build it as a monopoly. So collaborations mostly avoid that kind of monopolistic adverse effects of our administrative or governmental managerial problems. Public ownership and delivery of services, or the unbridled privatization without unlimited privatization of our healthcare services can be prevented by that kind of balance prevention. And for me, the most important benefits of that kind of collaboration is the enhanced resource utilization. Because as I tried to explain in the previous slides, each site has lots of advantages and some kind of difference or common resources. So if we can achieve the pooling these resources, both sectors can reduce the redundancies and enhance the efficiency of the healthcare delivery. Another benefit of this kind of collaboration is the build innovative system, and also the system which is open to development, that kind of for the advanced technologies or some kind of new interventions or ideas. And the collaboration or partnership between the private and public sector can speed up the introduction of advanced medical technologies from public sector to especially into the public health or other health related programs. And if our main goal is to build a system as accessible and equitable, we can use the sources from both sides to provide the 100% accessible and equitable services. That kind of collaborations can expand the healthcare access for example, the rural areas, underserved areas. We can provide some remote options to use the current technologies like telehealth or telemedicine to promote the health equity among the members of our society. And let's just try to make a focus only for the public health rather than our general health system, healthcare services. It's not easy to engage the private sector in the public health services because it's not easy to make. I'm trying to be careful say that, but the profit for the private sectors according to their mission, vision, and ideas, but we can create some sensitive, delicate collaborations between the private and public sector in the public health services. For example, involvement of the private sector in the health research, can lead to the development of new treatments and preventive measures. We had a very current examples during the pandemic. For example, the developing and improving the vaccines mostly performed by the private companies, but without the support of the governments or countries, I mean the public sector, it's almost impossible to be produced accessible and relatively affordable vaccines to the whole population who need to get vaccinated against the COVID-19. I mean, we know that there are some problems or weak sides of that kind during the pandemic experience, but it's still, it's still better than the without have any vaccination. So we can improve that kind of the structure of the collaboration, but we have some current examples too. And our public research institutions, public universities can have lots of experienced, high qualified researchers, faculties, and this side of the sector can enhance the resources, expertise, and or funding of that kind of research projects. And as I told you, the vaccine programs or also, the implementation of the vaccine programs, we can share some goals and ideas with the private sector. For example, in the many countries, like our country, Turkey, and other countries, private health institutions, private clinics also perform the vaccinations, like the childhood term or adult term. So we have some also real world good beneficial examples for that kind of collaborations. And the information technologies, medical technologies, or some educational resources can be produced by the private sector and distributed and promoted by the public sector in the all around the countries. And finally, if we would not achieve that kind of involvement, engagement of the private sector, we have at least can do the to improve, to force the private sector as our regulatory role in the public sector to produce, to build some corporate social responsibility programs by the private industries, private countries. The companies. What are the essential strategies to build an effective collaboration between the public and private sector? When we look at some published papers or performed previous researches, there isn't any optimal balance between public and private sector. Each country, each population has their unique story, and it's closely related with the other factors like the political agenda, the current economical status of the population, the needs of the population in terms of the healthcare. I mean, if it's a younger population, their needs are different. If it's the elder population, their needs are different. So it's not easy to create a optimal balance. One more thing, and I think we should discuss later as another session or in a kind of the workshop. Healthcare by the public and private sector are not mutually exclusive. What does it mean? For example, as a person, as a patient, as an individual, I can get some services from the public sectors, but also from the private sectors too. So there isn't a absolute exact separation for their targeted population. This is also another reason to build a optimal intended balance between those sectors. But two main items is, I think, is the essential for the it must be the base on our strategies. The first one is the developing shared goals is very important to forge effective public-private partnership collaborations. It's essential to develop shared goals which respect the values and objectives of the both sectors. But for me, it must not be equal. I mean, you know if the improving the health status of our population, if our main idea is to build a healthier tomorrow, we must first consider the benefits of our whole population rather than some privileged population, which is under the target of the aim, the goal of the private sector. That's why we should always consider in the top of the list in the benefits of our general population. And second essential strategy to be able to create an effective collaboration is the building trust and transparency, because we have really trouble with some illegal activities, unlawful acts, or some conspiracies, gossips, etc. Some theories which are not based on the real facts, especially again in the pandemic area in the last couple of years, we had a real trouble to be struggle against the infodemic about the virus, vaccines, other medical treatments, etc. There were lots of adverse effects during our struggle and fight against the pandemic. So building trust is so crucial, requiring transparency in our operations, and mutual accountability is so important to ensure the sustainability of that kind of collaborations. Adopting models which have proven effective in other contexts can be beneficial. These might include co-financing arrangements, joint ventures, some contractual agreements which specify the roles, expectations, and outcomes between the whole shareholders or partners. What are the essential, the main challenge and some possible solutions for this? Goals and values can be differed between both sides, and bridging the gap between the profit-focused private entities and equity-driven the public health goals requires open dialogue and shared objectives, as I tried to explain the previous slide. Establishing clear shared objectives and building the regulatory frameworks which support these goals, we can manage these kind of troubles or challenges. Because we need to have some, we need to navigate or reform our regulatory landscapes to facilitate the smoother cooperation. So, I mean, during the presentation, I slightly stand on the public sector side, but in some cases, public sector should some reformative acts or regulatory improvements to make some facilitate create some smoother cooperations with the public sector. And the last but not least challenge is the competition between the providers. It's a really threat to be commercialize our healthcare services in 100%, or to leave the whole healthcare services to the market, because it's really reduce the cooperation and information sharing, and it may lead to over specialization or fragmentation or excessive use of the technology. We especially on the people we don't need to use that kind of new, expensive, and rarely available technologies to attract patients or population, kind of commercialization or advertising of the medical. It's a bit related with the medicalization of the life. So it's, as I told you before, it's last but not least challenge, and we should consider always find some solutions to handle, to manage this challenge. As a final slide, in the conclusion, we can neither leave health entirely to the private sector or nor to the public. I think it's one of the it must be it should be our main goal to build collaborations to improve the. I mean, as if our main goal is to improve the health status of our population, we cannot concentrate or focus on the only one side of our system. And I mean, it must be to be one of the main questions about this issue. Why not we try to find a balanced approach which improves the private sector's innovation and public sector's ability to create affordability and accessible health systems for all. And bridging the public and private sector seems to combine the best of possible worlds, with, I mean, the private sector with its efficient management and use of incentives and the advantage for the generating new technologies, but also the public sector with its regulatory actions, its stewardship role, and keeping and protection of the benefits of the public or of the public interest. And finally, we can call to action to be pleased, as a kind reminder from me, consider how in your professional capacity you might foster these collaborations to improve health outcomes. So it's end of my presentation. I really appreciate your attendance, and if you have any thought or question about this presentation, I'm more than welcome to hear about your thoughts about our topic.
Thank you, Ömer, for the presentation. It was brilliant and thought-provoking. Please, everyone, if you have any questions, raise your hand, or you can write your comments or questions in the comment section. Actually, I have a question while waiting others about, like, generally about the collaboration between public and private sectors. I think that currently, especially in certain countries, but generally all around the world, private sector is getting more and more, how can I say, strong or advantages, or I don't know. So they are getting more place in the health sector, and as you mentioned, mostly they motivated by profit. But governments and other institutions has different motivations. So even if we would like to create collaborations with private sector, would it be fair, or would these processes be fair and how can I say, transparent and advantages for the general public? Because I still have some concerns about how the private sector approach to these collaborations, because they, even with these collaborations, they will aim more and more profit, and I'm not sure if they would like to step down from their certain advantages, especially, for example, in the countries in the United States or some similar examples. Yeah,
thank you for the this question. I mean, yeah, as you told that it's not easy to bring the private sectors with all of their benefits to the some public services. But when I was thinking on this topic and the presentation, I realized that the major rule or major move must be to create a well-defined regulatory framework. That must be the first one. And these frameworks requires political consistency, political stability. If the government or the officials of the public sectors stands strong with the that kind of regulatory implementations or laws enactments, it must be it should make easier to build that kind of collaboration. And the second thing is, I mean, if we we can not easily talk about that kind of countries which almost all of their system. I mean, I don't mean the healthcare, but also in the all governmental or public system closely related or even dominated by the private sectors like United States. But for example, in that kind of Turkey, France, or some other developing or developed countries, which also has the strong governmental structures, bureaucracy, and the background of the bureaucracy in the history. The second thing is related with that kind of structure in these countries. I mean, you can improve, you can build that condition is a kind of prestige among the population or prestige of that kind of private companies, sectors, industry among the population. I mean, it's a kind of, you can promote as the corporate social projects, or it's a kind of duty of the private sectors must be performed by them to their population. But it's not enough. I mean, it's not easy to handle whole problems, and according to some reports or researchers about the future of the health systems, this is one of the most essential challenge. I mean, to build a balance between the public and private sectors in the healthcare services listed on top of the list. You are on mute.
Sorry about it. Thank you for the answer. I think, yeah, these points answers my question. Yeah, I agree that there should be a kind of political consistency and stability, and maybe a kind of strong government should be there with proper institutions. This is one challenge, and also I'm not sure. I'm not sure if it's a question in the field, but when we mention about the collaboration between private and public sector, do we accept them as equal? How can I say counterparts, or do we accept governments above them and governments like how can I say making bargaining with them, or how can I say making agreements with them, or vice versa in other countries? Yeah.
For me, as my personal experience or personal opinion, the public sector is the dominant or more weighted part as their regulatory roles, and always must be always consider the interest of the publics instead of the some entities or some special groups. But it's, yeah, we should discuss the both pros and cons of that my opinion. But for me, it seems, I mean, especially in that kind of modern area, industrialized and also the imperialist area, it's not easy to define as a equal partners. It might be equals in the some special projects or some special agreements, etc. But in general, it should be not equal in terms of our the perspective to sustain and improve the health status of the population.
Thank you for the comment. I think Sabanu writing a question now, or comment, I don't know. Sabanu, can you hear us? I'm writing a comment. It seems like that, or if you would like to take the microphone, I can give you an access. Yeah, it might be an error. Yeah.
Okay, thank you.
Yeah.
Can you hear me?
Yes.
Yes, we can hear now.
Okay, thank you. Yeah, I was trying to be quick, but so thank you for waiting for my question. Ömer, thank you for the presentation. It was comprehensive and it popped up so many questions on my mind. But I have a question and comment at the same time. What do you think about, can public or the governments can make private sector to play the game on their rules about health? So I'm sure that you got.
But even, I mean, you can continue with also your own comments, then we can discuss about on it.
Yeah, sure. The comment side is, so the governments and the public sides and Ministry of Health and the government side has the power of ruling and making laws. So with some, so my comment, I can see a way to, if public sides can be more powerful, or maybe if they can understand their power on the private sector side, maybe the public side can use this power to, like I said, to make some private sector to invent on health more than today. So that's the comment, but do you agree, or can you see a way to do so?
I'm not sure. Yeah, actually, yeah, I'm aware about that. It's a kind of ideal or some sort of it might be looks like the utopic idea to bring them, especially in the public health services. But it's and we always discuss about this. Most of our theoretical frameworks or concepts cannot be always implemented as what they are. And if it's a reality, I mean, it's not possible to remove all things related with the private sector, especially themselves. We should try to find some opportunities or available ways to bring them or drag them to the public health services. Actually, the main thought I understood that headline, we should find some ways to use their advantages or sources to provide some benefits to our public health goals. But I know it's not easy. I mean, each level of countries has different problems like this. I mean, if you are underdeveloped or developing countries, like economical problems or economical without any economical stability or independencies, yeah, private sectors can dominate the healthcare services or markets. Or if they are too strong, even if you have a great governmental structure, they might be affect you or manipulate you. But I mean, the one more thing is the instead of the focusing on the wider areas, the country level or global level, that kind of collaborations, we can focus on the some smaller projects or services to be able to start that kind of synergy or collaborations.
Thank you. Any other questions or comments for today? If there is, please raise your hand and I can.
My
Give you-
pleasure.
Yep, I think we have done with the questions and comments. Yeah, I just would like to thank you, Ömer, for today's presentation, and thank you all of our team organized these seminar series in this week for European Public Health Week events, and all presenters, moderators, and all of the members. Thank you very much. I will just give you the last verse, Ömer, and we can then close the meeting. Yeah.
Thank you. I'm really feel grateful and honored to be part of that kind of webinar series in this week, and I wish to see organized in the next episodes, in the next opportunities and available dates, that kind of some special themes or weeks. And thank you for our society.
Thank you. Then have a nice day, everyone. We can finish the meeting and see you all in next year, maybe, yeah, for this series.
Okay. Bye. Have a great weekend.